and you watch right in front of you, these patients go from being open mouth, breathing, sleeping poorly, having ADHD, signs and symptoms of ADHD, all sorts of behavioral issues, socialization issues. And when you figure out if it is an airway problem and then address the anatomy to normalize it with your medical colleagues as needed, and then you can incorporate oral myofunctional therapy as well, which can be a huge adjunct, you transform these kids' lives. And that really was what started to happen time and time and time again. So when I talk to my ortho colleagues who say we shouldn't be helping them try to do this young, I'm like, so we just wait and let it be a surgical, let them suffer for however many decades of their life. They're going to suffer, not just from a craniofacial growth standpoint, but now we know from the medical literature, tons of medical literature talking about, I mean, even the fact that some of these patients who have there's been studies to show they have decreases in gray matter. I mean, they actually can, there was one, I think it was the one, Isaiah and colleagues in 2021, they talked about those who snored or even gasped during sleep, had looked at over 10,000 MRIs, that those patients had smaller amounts of gray matter in their frontal lobes. So this is big. This is big stuff. And so you guys have to go in and clean up, unfortunately, a lot of our errors in diagnosis on these patients who we could have detected this stuff on earlier and gotten these patients more proactive, as we left off last time talking about Peter Attia and the concept of being more proactive in our approach to our healthcare.